I've had this tattoo for 12 years, and I can't hide it, and I'm pursuing a nursing career, and I feel that it's very detrimental to doing that.
It's kind of an embarrassment to have, on my arm when I go to the beach with my wife and my daughter. It's just kind of a thing I don't really particularly want there, basically for them and myself. Just an embarrassment thing that I had done years ago that I really didn't want done.
They're kind of ugly looking, so if I can get rid of them, I just as soon get rid of them.
Until now, there was no easy way to remove tattoos or pigmented lesions, like brown birthmarks, liver spots, and the dark spots caused by too much sun. Earlier methods burned or scraped the skin and could leave disfiguring scar tissue behind. But now there's an advanced laser technology that removes tattoos and brown spots with minimal risk. This new laser produces pulses of intense light, which can pass through the skin surface without causing any damage. When the light hits tattoo ink, it is absorbed very rapidly and breaks up the ink into tiny microscopic fragments. Then the body's natural cleansing system carries the ink away. Laser light can be different wavelengths. The med-light laser uses two wavelengths, an invisible infrared light and a visible green light. The infrared wavelength is used to break up dark tattoo inks, while the green light removes red inks. It also eliminates abnormal concentrations of melanin, which is the pigment that is found in brown spots and birthmarks. Patients generally find the treatment quite tolerable. First, safety goggles are used to protect the eyes. Then the laser is moved rapidly over the skin. Its strong pulse of light may feel like the snap of a thin rubber band or specks of hot bacon grease hitting the skin. A local anesthetic can be used to counteract this discomfort, but most patients do not require it.
Just like a rubber band snapping your arm, it's not very bad at all.
Surprisingly painless.
Each treatment is very quick, only a few minutes. When it's over, the skin may whiten a bit and have pinpoint bleeding.
The whiteness is going to fade over the next couple minutes.
Then, the remaining tattoo begins to fade slowly as the body's filtration system carries away ink. This occurs over the next 4 to 6 weeks until it's time for the next treatment. When brown spots are removed, the skin will whiten and then develop a slight blistering and bruising. This will heal in about 7 to 10 days. After the skin is treated, the doctor may apply ointment and a bandage. Then, to help prevent infection and scarring, home care should include keeping the area clean, treating with ointment, and protecting with a bandage until the skin is completely healed. Patients may shower the next day, but should not scrub the treated area. Usually, only one treatment is needed to remove brown spots. Some birthmarks may return after several months to a year, but treatments can be repeated.
And I'm really looking forward to the results. It'd be nice to have hands without the brown spots again.
Tattoos require several treatments, spaced 1 to 2 months apart.
This section right here has had 1 treatment done on it. This wing has had 2 treatments.
The number of treatments depends on the type of ink, the amount, and how deep it sits in the skin. Usually, professional tattoos require 5 to 6 treatments. Amateur tattoos may need 2 to 4. Blue, black, and red inks fade the most. Oranges and purples also respond well. Green and yellow inks are hardest to remove, although they can fade more with additional treatments. Because there are so many different types of ink, it is difficult to predict how much any one tattoo will fade, but most disappear almost completely, providing you with a new image and sense of self.
They made really snide comments about what type of person I must be because I have these tattoos, knowing nothing about me, and it really bothered me, and I think that has a lot to do with wanting it off.
Not to carry around the markings of past life. It'll be just a great healing. I'm eagerly awaiting whenever these are gone.
There are many ways to have tattoos and pigmented areas removed. The decision to use the med-light laser is your choice. It uses the most advanced laser technology now available. It can reduce tattoos and dark patches very successfully, with a minimum of discomfort. If you have concerns, consult your doctor. Be sure that all your questions have been answered before you make a final decision.